Hereditary cancers. To start, we will discuss what goes on in wild-type cells. Under normal circumstances, cells divide, each with identical genetic information. However, in hereditary cancers, mutated cells arise due to genetic predispositions someone inherits. Therefore, selection can act upon cells if a mutation confers the ability for cells to proliferate. If this occurs, we call this hereditary cancer. One trait that is commonly selected for is the ability to overuse fermentation pathways. In cancer cells, this trait increases the amount of energy obtained per unit time. The 80% of cancer cells that utilize this pathway greatly outcompete wild-type cells. Mutated cells, with traits conferring the ability to resist common anti-cancer drugs, are also selected upon, thus increasing the chance of mutated cells becoming cancer cells. However, the fitness or how beneficial the mutation is to a cell can vary. Not all mutations are created in the same manner. At times, different inherited cancers can acquire mutations at varying rates. For example, an inherited defect in the BRCA gene, which confers DNA stability, leads to cells being much more likely to mutate. We will simplify the varying ways cancer cells evolve using visuals. Beneficial mutations that are acquired in a stepwise manner yield slow and gradual changes after each generation. This is called stepwise evolution, characterized by low-level rearrangements and more stable homogeneous cells. Under punctuated evolution, new beneficial mutations are acquired rapidly and drastically change the cell's genome, thus yielding genome instability, causing numerous genetic changes and heterogeneity among cancer cells. We will now uncover the differences between cancer cells that undergo varying forms of evolution. Cancer cells, under stepwise evolution, grow under the selective sweep growth model, meaning cells that acquire slightly more beneficial mutations are gradually introduced in the population and replace previous strains. However, cells under punctuated evolution grow under the Big Bang model. Therefore, all strains represent an equal proportion of the tumor size. Competition among cancer cells leads to differences in phylogenetic topologies, which change as some populations go extinct or as some strains undergo virtually no selection. Also, because beneficial mutations are acquired at different times, the fitness levels, as time progresses, vary between cells undergoing stepwise and punctuated evolution. Lastly, the form of evolution employed alters tumor composition, thus allowing observers to make inferences about the allele frequencies among cancer cells and tumors, a benefit especially important in the healthcare field. Since this information is key to healthcare professionals, doctors can prescribe better treatment options to patients tailored to target strains.